So we have it, yeah. So for those of you who are online, could you tell me if you can hear us, please? I hope the chat is open. Sorry? Good. I'll take some. I see that some of our colleagues online aren't connected to the sound, so I hope it's okay. Let me just listen if I can hear. Yeah, okay. Okay, I guess, what do you think? Should we get going? I hope that those of you who are online can hear us. I see Gladness, for example, George, please, if you can hear us, give us a text in the chat. I have the honor today to both handle the technical aspects and the moderation on behalf of our colleague who unfortunately had a last minute situation, so she couldn't be here with us today. So it's my honor and privilege on behalf of her and on behalf of my colleagues to moderate this session on connecting parallels, reaching milestones in substance use prevention, treatment, and recovery to the East African Network Partnerships. And I would like to welcome you all on behalf of the wonderful sponsors that we have today. We have RECOVI, Community Outreach Burundi, the Crisis Resolving Center, C-Sema, Organización por la Promoción Agro-Pastorale y Développement of Congo. Sorry, Dandy, you'll have to help me there. Recovery Society, Recovery Solutions Treatment and Counseling Center, Slum Child Foundation, Soberlife Mentoring Society, Uganda Alcohol Policy Alliance, Uganda Youth Development Link, and Willingway Wellness Foundation and WFAD that I'm representing here as the moderator. So this side event showcases the positive impact on regional partnerships and what the positive impact that regional partnerships can have. It's a direct result of the collaboration between our partners in the East African region for a period of time and working to connect these parallels between prevention, treatment, and recovery through a continuum of care. So the organizations within the network are connected and represent different regional parts, countries, and regions of these countries. But unfortunately, many of them, thank you for help. Many of them couldn't be here with us in person today, so we have them online, and we'll have some of our colleagues present online as well. But we have two fantastic people here today with us. And first of all, I'd like to give the floor to Paul Maguru. He is the founder and international director of Soberlife International, and he's the WFAD liaison representative of the East and Central Liaison Office. And he also supports the East African Network. Paul, who went through a decade of substance abuse and isolation from society, represents the face of African youths who have great potential in just transforming their lives, their communities, and the world at large. And I can contest to that. So I hand over to you, Paul. I'll do my best to share the screen as well, but the floor is yours.
Yeah, thank you so much, Regina, and for those wonderful comments and compliments. Of course, it's our honor, together with my colleague here from GRC, Wendy, to be in this conference in person. And as you rightly say, that we have wished many of our colleagues from Africa, and most especially in the field of prevention and treatment, to be with us here. But for some reason that we could all be familiar with, it was not possible. But we look forward to a time that we can have as many of these sessions. Of course, we have a number of presenters. I'll just go straight to my presentation. And I'll just give an overview of the situation in East Africa, because we have quite good detailed presentations coming up from our other panelists. So I just want to give an overview of East Africa, so that maybe someone in the hall who may not be familiar about East Africa, if you're aware, in the next slide. Yes, and that is East Africa as it is right now. It used to be East and Central, but right now, with the entry of DRC into the Federation, we have that beautiful outlook of our region, stretching from the Indian Ocean to the Atlantic Ocean. We have Somali, Kenya, and Tanzania. The eastern side, we have Uganda, we have Burundi and Rwanda, and South Sudan in the middle, and then we have Congo in the central and western side, touching the Atlantic Ocean. And so we are a total of 8 African states from the Eastern African region. And just for an overview, the next slide. Yeah. So, and we start with the positives. Yeah, that we have a very active population, combined total population of 302 million people, majority of who are youth. The 60% of the population are youths who provide a vibrant labor capable of transforming the social and economic status of the region. And we share common cultures. We are diverse in different ways, but we have many common elements that bind us together, very communal, very hospitable people, and those who have been to the region, they can attest to that. And with people who have very open attitudes to receiving ideas that can help in the social transformation of the people. We have a common language, which is Swahili. And as of 2 years ago, it was debated and agreed in the African Union that actually Swahili is to be the African language. So possibly very soon it shall pass like a law that as long as you're an African, you have to communicate in Swahili. And this is for very positive progress of the region. And we have the richest region in the world in terms of natural resources, minerals, forests, abundant water sources. As we say, it's ocean to ocean, ready for investment. And closely to that, we also have the most exotic touristic features for those who may want to come and see the real origins of mankind. All that within the East African region is a package that you don't want to miss in your lifetime. But as we know, every good thing has challenges, and therefore we're going just to check on some of the challenges that we have. And we have continuous political instability since the time that majority of the nations received independence. And Danny maybe just share a little bit of that. We've had continuous political instability with many deaths, displacements, and a current situation of poverty, low economic and infrastructural development, posing great challenges in accessibility between cities, villages, local markets, and the international world. And then overstretched social amenities such as healthcare and education, and we shall see how that connects with the issues of drugs. And porous borders within the region with an influx of illegal goods and services, including drugs, arms, human trafficking, among others. And some of the countries are isolated from global interests or focus of development. If I just mention the name Kenya, majority of the people even in the room can know where Kenya is. Somehow they have an idea of where Kenya is. But if you then just mention the name Burundi or Bujumbura, someone will start trying to locate it in the Google Maps. So there is a great isolation of some of the countries in the region, just from the global affairs. So we just want to see an overview of matters regarding drugs, because this is why we're in this session. That was just a background to show the situation as it is now connected to drugs. Is that the reality is that all countries that we mentioned, and of course Africa at large, it's hard hit by this devastating habit, and especially in East Africa for many good reasons or bad reasons. And most of East Africa leads in most of the drug patterns, consumption, trafficking, and other issues. And the youths are the most affected. Remember, we said more than 60% of the population is youth. So when this population is affected by that habit, then you know what the outcome of that would be. And it's a direct cause of the slow development progress in the region. And new drugs have easily penetrated into the big markets thanks to the advanced communication and social media channels. So we have a connected world, and what's happening in Sweden, what's happening in the US, what's happening in Asia, within a few minutes, it's all over the internet, it's all over Kenya, it's all over even in the villages of Kenya because of that interconnectedness by media. And specifically about the country situation, Kenya has a relatively well-established economy, and in terms of civil society that deal with drugs, and also institutions within the government. But again, Kenya is the most vulnerable among all the nations because of its openness. Yeah, it's exposed, and it's also a favorite, resort center for all kinds of trade, for all kinds of investment, positive and negative. So with its good economy and good infrastructure, compared to the rest of East Africa, but it's also the most at risk and vulnerable. Tanzania also, it lies on the transit corridor on the coastal area. So it doesn't have a very well functional drug policy, although we have very vibrant civil societies which can, support any policies that needs to be put in place. And that's what part of the East African network is, to advocate for policies within the government that can favor the community in terms of prevention and treatment. Uganda is still advocating for an alcohol policy through one of our partners, Uganda Alcohol Policy Alliance, UAPA, and one of the presenters will be giving a detail about the East African network. But the bill for this kind of intervention is still in the parliament, almost for 10 years, waiting for approval. But we hope that along the way, with the support and advocacy from all partners, it will go through. DRC, Rwanda, and Burundi, they are major destinations of the transit, arms and drugs, which go hand in hand. So as much as they are not so much in the limelight of maybe development, but yet they are destinations for this kind of issues. And other countries like Sudan, Somali, which just recently joined the bloc, we don't have so much data. They are still not very open societies. They're still a bit conserved. Ethiopia, Eritrea, and Djibouti are part of this the region, but we don't have so much interaction with them. But we hope through this kind of network, we are able to penetrate and also to get the details and get them on board so that we can walk the journey together. Therefore, with the unfortunate currents of national and cross-border insecurity, women, children, and youths are the biggest casualties, facing trauma, poverty, and all the interconnections between these issues and drug abuse. Most of the countries do not have clear data on national statistics of the drug status, consumption, or distribution, and this makes it difficult to measure the level of challenges or successes and the evidence-based policies that need to be that are needed to mitigate the issues. And all countries lack accessibility to affordable treatment and recovery resources, which is one of the things that we are really pushing for with the governments, engaging with the government to see that people can have access even to the basic treatment, basic prevention services, which are very lacking in the region, because governments sometimes are prioritizing on other things, which they feel are more urgent, and yet the root causes of the issues are not well taken care of. So that is the overview of the drug situation in the Eastern region. I will have some of the presenters just giving the details of the experiences and some of the projects that we have carried through as a network. So as the liaison representative between the international partners, WFAD, and others, the role of the representative is to carry out baseline surveys, do some assessment and focus group discussions just to bring out the status or the condition that is right at the grassroots level, organize and coordinate community and public participation events and support active community work groups, and that's what we've done over the period of time that we've been in existence. Almost maybe 10 community and public participation events where the voices of the people right at the community can be heard at the government level, at all the way to the international level, like we are doing right now, and plan and coordinate networking workshops for both countries, and I mean at the local country level and the regional partners, and then engage professionals in trainings and capacity strengthening to our partners, support the government on relevant community and policy matters, mobilize financial resources for forums, public engagements, and economic empowerment projects. Dandy, we mentioned about one of those projects, and then expand the reach to other regions. We realize that we are not only the ones affected within East Africa, other regions like West Africa, South Africa, they face similar challenges. And once we have something that is active on one side, we want to share the same with other regions and also learn from them what they are doing. And I've had the opportunity also of doing some things in the southern region in Zimbabwe. There's also some projects that are happening there, and we've been engaged on how we can support them in the psychosocial affairs, and advocate for the voice of grassroots organizations to be heard at both the international platforms in the African Union level and also at the United Nations. And this is what we are doing right now. And finally, the East African, the common objectives of the East African network, formation and strengthening of the East African network and country chapters, which are led by the focal person. I can see almost all of them are online, and I say hello to each one of you. Learning and best practices exchange forums. We have had 3 so far, 2020, 2022, and just 2 weeks ago. And we're so glad that we had the support. We have always had the support of WFAD. Capacity, technical and professional support. We get it from the government institutions such as NACADA, from ISAP, and from the Global Task Force, which is supported by DFF, Drug Free America Foundation, thanks to Amy, and connecting the parallels between prevention and treatment, organizing focal group discussions, public events, and training workshops, advocacy at local, regional, and international levels, through all the different multinational and international organizations, social economic empowerment projects like the one in DRC. And in conclusion, we are united as a network, we are united as individuals, we recognize our responsibility to nurture the next generation and face the challenges and address them in the best way that we can. And while for sure all over Africa, we talk about the financial resources being a challenge, but we are so glad that we have the most basic and important resources, and that's the human resource. We have people that are passionate. We have people that have the zeal and have the vision to see that the issues of drugs are, addressed, and how the next generation can be people that are active citizens, free from all the shackles of drugs. So we want to extend our special appreciations, especially to our international family, WFAD, CEDA, for supporting us financially, the Swedish Institutes and the Drug Free America Foundation providing us support to attend international forums for learning, sharing, and making our grassroots voices be heard at the international level, and the spillover effect that it brings back to the local community. I say thank you so much, and I say asanteni sana in Swahili for your presence and for your listening.
Thank you so much, Paul. It was a great introduction, not only for us to learn more about East Africa, but the fantastic work that you're doing in the communities and across the communities in the different countries. And I have to say, I'm one of the lucky ones that have been together with Paul and Dandy in Kenya. Sure. And it's one of my most cherished moments. I mean, it was one of the most beautiful experiences being both in Kinshasa and then going to Nairobi and Mombasa. So very thankful for that experience. I see our next speaker actually joining us online, but she's been kind enough also to share a video. So if you bear with me to try to share this with video, I will like to introduce our next speaker, Dr. Kikome Ruth, who is the Executive Director of Recovery Solutions Treatment and Counseling Center. And she's the Secretary of the East and Central Platform for Prevention and Treatment of Alcohol and Other Drugs. She has a PhD in counseling psychology and is an internationally certified addiction treatment professional and a universal prevention curriculum graduate. So we're very happy that Ruth was able to pre-record the video, and I hope that I am able to do her justice now by getting the sound across. And let's see her presentation to us.
Ladies and gentlemen, I send you greetings from Uganda. My name is Dr. Kikome Ruth. I am the Secretary for the East African Network. The East African Network was founded in Kampala, Uganda. Following the Kampala Declaration in February 2020, many civil society organizations deliberated on the need to create a regional network that would advocate for policies and best practices geared towards reducing substance abuse. Our vision is to be a vibrant regional platform advocating for reduction of substance abuse in the East African community. The activities of the network are guided by a threefold objective. Objective number one of the platform is promoting research and establishing a platform for vital information sharing on evidence-based interventions for substance abuse. As a network, we've done too much research concerning substance abuse, concerning policies, and we are looking forward to giving the best as in form of prevention, treatment, harm reduction. The second objective of the platform is engaging the East African community in progressive policy formulation against substance abuse and ensuring substantive implementation of the set policies. For example, in Uganda, we have Uganda Alcohol Policy Alliance, which is doing a lot in advocating for policies to reduce alcohol harm. In Nairobi, Kenya, we have the NACADA, which is doing a lot in implementing the set policies, and this has reduced the consumption of alcohol and other drugs in the region. Objective number 3 is engaging the East African governments and key stakeholders for comprehensive substance abuse prevention within the East African community. The network has conducted 3 regional annual meetings. One was conducted in Kampala, Uganda in 2020, which aimed at capacity building and establishment of this very network. The second and third engagements were conducted in Nairobi, Kenya in 2023 and 2024. The 2 engagements in Nairobi aimed at uniting and empowering both prevention and treatment professionals to achieve best practices in prevention, treatment, and recovery of substance abuse disorders. The network has also been able to expand the membership from 3 to the current members, which include Burundi, the Democratic Republic of Congo, we have Ethiopia, Kenya, Tanzania, and Uganda. The network has been able to increase on the number of addiction professionals through a series of capacity workshops conducted in the previous years. In addition, the network has been able to establish country focal persons who have made information dissemination faster, and this has reduced on the work burden from the executive. A number of civil society organizations and like-minded individuals have joined the network, and this has been witnessed in the just concluded 2-day workshop that was held in Nairobi, and we hope for more. There is a strong commitment of the member partners who give much of their time and commitment to see the network achieve its objectives. Lastly, but not the least, the network has continued to receive funding from World Federation Against Drugs. During the 4 years of existence, the network has faced a number of challenges, which include the COVID-19 pandemic that affected our 2021 and 2022 regional meetings that did not take place. Secondly, the inconsistent regional meetings due to limited funding. As I told you, we've gotten one funder, and this funder cannot fund 100% of the activity networks. Lastly, the low level of addiction professional experts, which needs to be scaled up. We do recognize the World Federation Against Drugs for their support. We are looking forward to more countless partnerships in our shared mission. Thank you very much for listening. Merci beaucoup. Murakoze cyane. Amesi ejina lebu. Asante sana from me to you.
Thank you, Kikome Ruth. I know you're online, so we thank you very much for that. That was a great presentation of the network and the work that you've been doing for the past 4 years. Our next speaker now will be Mr. Daniela, who is in the room with us. We continue with this hybrid format, and it's going very well until now, I find, so I'm happy. Daniela is a close colleague of mine. He is the country representative of WFAD DRC, and he heads the project in Kinshasa called Sober Youth, Healthier Societies, Transforming Violent Youth of Kinshasa. So we'll hear a great presentation about this project. And the floor is yours. And allow me while I try to share the screen here. You can start.
Thank you so much, Regina. So first of all, I want to say thank you to Regina and my international president, Amy, of Director America Foundation. The others who strive to have me here attending this CND, and thank you so much once more, Amy and Regina. So I'm going, Paul is made a presentation of Eastern Africa, but I would like to talk a little bit about the DRC particularly as a country, because yes, I think Regina, you can go to the next slide. The DRC, next slide. As you can see on the African map, the DRC is a country which is in the central Africa, but having also is lots opening to the western part of Africa, to the Atlantic Ocean. But we have a lot of interaction with the eastern part of the DRC with East Africa. And since the 2022, 2021, the DRC has joined the East African community. So it's in the same time in the central, eastern Africa, but is also a member of the Southeast Africa, Counselling. So meaning that the position of the country is as such that we deal with almost all the economic regions of Africa. And the country is the second largest country in Africa so far after Algeria. And population is around, because it's an estimation, 112 million. But some people say it's even more because the last census took place in 1984. So they're still waiting for a new one, but they estimated to 120 million. So it's a country with 9 neighboring countries, and which has one of the strongest rivers in the world, the Congo River. That's why the country name was named after the Congo River. And today we can say that Kinshasa is the capital city, and we have around 18 million people living in Kinshasa itself. So it's a huge city and one of the largest cities in Africa. So talking about WFAD to DRC, so the journey started in 2020, but not in 2019. Mr. Paul Mburu was here with me. He started with a pre-study about this violence situation and security in Kinshasa, and it resulted in visits of some of our board members. As you can see, Regina is there on the picture. And they visited Kinshasa in February 2020. Just 1 month later, it was COVID lockdown. But we started the process of opening the office, and it's become operational in September 2020. And in December, we launched the project that we call the Sober Youth project, which is funded by the Swedish corporation. So the project is a project that aims to prevent young people from a street gang, to avoid young people to join street gang members, and older to leave. So it was because of a situation in Kinshasa for the last 20 years that we call Kuluna phenomenon. It's a rise of insecurity in the country, So the police tried through repression to tackle this issue, but unfortunately they have failed. And today we can say that we have counterproductive results with the repression approach. That's why WFAD came with a social approach, saying we better look at the situation a different way, because it's not about repression only. Because many surveys conducted in Congo, please read the next slide, has shown that the situation is more an economic situation than a problem of, let's say, security itself. Because those young people are between 13 to 35 years old. They live in poverty, in bad situation, and most of them join those because they say their family are poor, they have no hope, there are no job, no employment, nothing, and for them, the only way to do and to earn their living is to join this gang group and try to earn their living. Next slide. So we can, next slide, please. So what is this survey about? It's about supporting young person to live and prevent others from joining the violent street means just, as we say, 18 million, and majority of this population is poor. When I say poor, it means poor. Less than 2 hours, even less than $1 per day. So you can imagine if those families living in some situation that even having $1 a day is, you know, if they happen to gain $1 or $2 a day, it's like having a trophy, because it's so difficult to live in. Next slide. So we have implemented, or we have been implementing this project with two main components that we call mental and psychosocial support. Why? Because those young people, okay, belonging to those gang groups, are taking drugs and all type of drugs and substances, and to commit and perpetrate crimes. They take all kind of drugs. So we said it's quite impossible for them to perpetrate all those crimes without taking those different substances. So it's crucial, first of all, to see how to support them, how to help them with mental and psychosocial support, and to help them stop using drugs. Because I did not want to put some images here, but they use machetes to cut people and to rob people, and we have even some murders reported by the police. So they are very brutal when they attack people with those knives and machetes. So that's why we say that mental and psychosocial support was crucial to start with. But we couldn't stop there, because the problem is not only about substance use, but it's also economic problem. So if we don't respond to this economic situation, so there is a risk that they may go back if there is. That's why the second component is about the empowerment process. Next slide. So as I said, so we all know that those who engage in substance use are more likely to commit crimes, offenses, and all those kind of things. And also we use the group interpersonal therapy as recommended by WHO. So we know that many of them are suffering from depression, and how to help them, okay, to decrease depression and also to improve their relationship, because most of them, after taking those kind of drugs, they even attack their family members and some neighbor people they live with. So because they are in a situation that they are not able exactly to know who they are dealing with, because after taking drugs and all those kind of alcohol, they are in a situation that they can attack anyone. The problem with them is what to get at that moment after taking this. Slide. So the second component I say is about empowerment. It's about responding to the economic situation. Yes, we have to support them and to help them stop using drugs. But after that, what can we do to help them face the economic situation and poverty? Because they live in endemic poverty. This is the second component that we are implementing to help them face the situation and to avoid them go back to the former situation they are in. Okay. So we implement this project, and so thanks to the Swedish cooperation, SIDA, through the Swedish Embassy in Congo. They have funded a project for 3 years, no, let's say almost 4 years, because we had 3 years and they have extended for 8 months. Normally we are stopping the project, we are closing by the end of this the year. And it's costed around $4.5 million for the full year of implementing the project. We have 3 local partners. One of them is CFAS. It's a specific organization, and we would like really to thank Mrs. Rose, who is the leader of this organization. It's a local organization supporting young women and girls living in a vulnerable situation. And they are really supportive of the situation, trying to help those vulnerable ladies suffering from gender violence based and things like that, to face all the situation. They have also playing the same role in the project, and we have Interaction and Dassault, which are the two partners in terms of employment process. So as you can see, I said that it was in December 2020 that we got a process with the Swedish Embassy. Next slide. So the result today, we are proud because when we started the project, we plan to have 1,500 of young men and women to be supported, but unfortunately, with the situation in Ukraine and also some rate change with the Swedish krona and US dollar, unfortunately, the budget that we have been allocated has decreased, so we have to revise our target. So we plan to have 1,000. So today we are proud because we have more than 1,000, exactly 1,036 of young men and women, exactly 586 young women and 450 boys who are benefiting of the project. 390 of young women today have been empowered through tailoring, sewing, and cutting trainings. And we have 63 young women, okay, who have been trained in pastry cooking, how to make cookies, to make breads, and things like that. We have 49 young women who have been empowered through water production, because when we implement the project, we have some places in Kinshasa where they have not seen water coming out tap or faucet for 10 years. So thanks to the project today, you have families and communities having clean water for the first time after 10 years, thanks to the project. And we have 50 young men who are empowered through farming techniques, because some of them would like to become farmers. So we train them in farming techniques and also fish farming. And 100 of them have been trained in driving lessons. And for your information, one of our colleagues has hired one of the beneficiaries to be his driver. And another one has been hired by a company. So thanks to the project, so you see that we see the good result that are still coming. Next time. And we have 17 of them who are empowered through fashion design training and printing. And 5 others have been trained in hair cutting. And we have 150 young men who are empowered through waste collection and sanitation in Kinshasa, which is also a major problem in Kinshasa, which is a big city, and we have this problem of waste collection. And thanks to the project, we have 124 young girls, which are under 16, who have been supported to quit, life on the street and go back and be reintegrated into families. So they have been living with their friends and family, and then thanks to the project, we have reintegrated those young people to their families. Next slide, Regina. So what can we say in terms of key lessons? First of all, those people were members of street gang groups. They were very, very brutal. It was very difficult having access to them. So the first thing we have learned is about building relationship with them, because it's vital if you want to succeed. Because the first time you try to get access to them, there is an initial mistrust, and they are reluctant because they are afraid. They say that maybe you are going to take us to the police and then we'll be sent to jail. So we need to build this relationship over time. And the second thing is about building trust and also showing empathy, because those 3 things are very crucial if you want to succeed. And today we can say that when we see them, I remember some weeks ago, one of them, 3 of them saw me, and they came to me. I did not recognize them. They say, "Hey, Papa Dandy, how are you doing?" I say, "Who are you?" They say, "No, we are your beneficiary of the project. Look what we have projected." And they were selling it to people because they have stopped robbing people. This was something that really fantastic. Quickly, Regina, we can go on to the. So in terms of lesson learned, also it's about substance abuse and crime are closely intertwined, because they all say that before committing those crimes, they need to take drug and substances. And we have also learned that we have polysubstance use. They take all types of drugs. He can take, if he has cocaine here, he can take cannabis, he can take alcohol, and mix all different substances. And sometimes he doesn't even know how many substances he has taken, so it hurts them. And they have also some mental health problems, and that's why we are trying to help. So we can go quickly because I'm still.
Just 1 minute.
Yeah, 1 minute. Okay. What we have noticed is that we have increased self-esteem of those young people, pride and confidence, improve the relationship with their families and communities. The next slide. And we have also, you can see, you can go through all those pictures, you can see. So these are pictures of the young people, as you can see. You can go to the last slide, Regina, the last one. The last one here. Okay. So the conclusion is this. When we started the project, we started with the aim of supporting young persons to leave and prevent others from joining the violent street gangs of India. But today, as we are closing the project, the good thing is that we are closing it with a major goal of transforming those young and violent young people, former drug users, into micro-entrepreneurs. So they are going to a mentorship program to know how to manage small business units. And this is the process we are in. For the next 6 months, they are going now to be trained in how to manage all the different business units we have set up. And we hope at the end of the year that they will be able to manage all this business. Even when the project closes next year, we can see those guys managing and running their own business, becoming their own boss, and then hoping that in the future they will become maybe a successful businessmen and businesswomen. Thank you so much.
Thank you. Thank you so much, Dandy, for this fantastic presentation and the key lessons learned. Our next speaker will also be online. We have 2 more short online speaker sessions, and the first one will be Jane Mwangi, who is the Executive Director for the Willingway Wellness Foundation and holds a bachelor's degree in counseling psychology and a master's degree in gender development studies. She's deeply committed to educating, protecting, and promoting the rights and inclusivity of vulnerable groups, including women, children, and youth, not forgetting people living with disabilities, with close focus on education, capacity strengthening, and mental health. We're very happy that Jane is able to have pre-recorded a video for us today that we will watch. And after her, we'll have some closing words by George Oding. Sorry, after this, sorry.
Good afternoon, everyone. My name is Jane, and thank you for giving me the platform to share information about our incredible project initiated and implemented by partners within the East African region, connecting the parallels, uniting treatment and prevention for effective drug management in Kenya. The idea of connecting the parallels between treatment and prevention was born in early 2023. The primary focus was to explore potential collaboration between Soberlife and Heart Voices Africa in addressing substance use disorders within the community. We had noted that in many instances, practitioners in these 2 fields worked in isolation and even in ignorance from each other. A week later, Paul contacted me to convey that our concept had gained traction as WAFAD had expressed interest. During their conversation, he presented our idea and the outcome proved to be of interest. At the same time, the Swedish Institute under call of interest and our presentation proved to be uniquely relevant. As part of the EAN initiative, we formed a consortium consisting of 3 local organizations: Soberlife International, Students Campaign Against Drugs, and Heart Voices Africa, and WAFAD, as we believed working as a team in the best way to achieve our objectives. Our objective was to conduct a pilot project aimed at examining the initial stages of treatment within the spectrum of prevention. With the support of the Swedish Institute, along with the participation of the World Federation Against Drugs, WAFAD, Soberlife International, Students Campaign Against Drugs, and Heart Voices Africa, Our aim was to convene prevention and treatment stakeholders across 3 distinct regions of Kenya. That is Kisumu in the west, Mombasa at the coast, and Nairobi, which is the capital city. Our goal was to facilitate the cohesive interventions rather than operating in isolation, as is often the case. By bridging these sectors, we anticipate the development of more integrated and sustainable strategies for both prevention and treatment, benefiting the aforementioned groups in the long term. Our strategy involved collaborating with CSOs to gain insights into grassroots levels, practices, and the challenges they encounter in the realms of treatment and prevention. The first workshop for CSOs took place in the Western region, specifically in Kisumu City. This 2-day workshop series aimed at fostering connections between parallel efforts, thereby enhancing the integration of treatment and prevention strategies for effective drug management in Kenya. During the group discussions, participants had the opportunity to share their experiences based on their respective areas of focus, whether to be prevention or treatment. A prominent observation was that many organizations operate within their own sphere of expertise without clearly understanding of where linkages should occur in the continuum of care. CSOs deliberated on 3 pivotal matters. 1, barriers to integration, opportunities for integration, and poor support systems in the continuum of care. The results of the baseline survey on substance use disorders, conducted collaboratively by the coordinating team and our host organization, for instance, CSO, revealed significant challenges within the community. It became evident that addressing issues pertaining to SUD would necessitate collaborative efforts between both the treatment and prevention teams. From the discussions, the following areas were highlighted. There is a disconnect between prevention and treatment, lack of trained staff. Most of the CSO work within their framework, and this is not felt at the grassroots level. Language barriers, as most of the staff do not understand the local language. At our second forum, convened in Nairobi, we gathered representatives from diverse demographics, including youth, adolescents, individuals in recovery, and those from the informal sector. The primary objective of the forum was to dive into community-wide perspectives concerning drug and related issues. Through various groups' discussions, several challenges were highlighted, including poverty, fractured familial and relationship structures, healthcare accessibility, the escalating spread of HIV, and the enduring stigma associated with substance use disorders. During the third forum workshop, conveyed in Mombasa, situated in the coast region, similar sentiments were echoed. CSOs reiterated familiar concerns, mirroring those discussed in previous workshops, such as the distinct operation of prevention and treatment teams without interlinking efforts. Additionally, it was noted that a majority of treatment facilities are privately owned, resulting in limited community access to treatment due to financial constraints and inadequate funding. The findings from the 3 workshops revealed consistent challenges, recommendations, and opportunities, among other aspects. Some of the challenges which came up were dysfunctionality of family and family support, partnership and networking, cultural barriers, county and government participation, lack of qualified staff, lack of multi-sectoral approach, that is in collaboration, and the knowledge gaps between prevention and treatment experts. There was also an aspect of lack of financial support. Opportunities for integration also came up, where people looked at opportunities, referral opportunities, integrated programs between the government and CSOs, participation and networking, between the county and government collaborations, trainings and research, partnership and networking. As we came to the conclusion of the project, a workshop was convened on March 5th and 6th of 2024, gathering key stakeholders, including representatives from the East African Network Prevention Team, WAFAD, and the 3 participating organizations. The workshop aimed to facilitate further discussions on connecting the parallels and uniting treatment of drug management in the East African region. Representatives from Tanzania, Kenya, Uganda, the Democratic Republic of Congo, and Burundi were in attendance. During the workshops, diverse teams exchanged their experiences and perspectives on the integration of prevention and treatment strategies in managing drug-related issues in East Africa, emphasizing the concept of connecting the parallels. In a session facilitated by Rilian Kitao from the instance Kisumu, challenges and opportunities encountered by experts in both treatment and prevention sectors within their organizations were explored. Participants were encouraged to employ evidence-based methodologies to identify individuals at risk and those using alcohol and other drugs. Highlighted were the fundamental screening tools such as SCAT, which means screening, brief intervention, and referral to treatment, aimed at assisting individuals in recognizing their level of substance abuse and providing appropriate referrals. In the SCAT, the following items are part of the screenings. Ensure that those not using don't start and are informed of the risks. At what point do they go seek help for treatment? Following the workshop's conclusion, participants were organized into groups to discuss and exchange their experiences, challenges, and potential actions to be taken. Subsequently, it was noted that their conclusions closely mirrored those of previous workshops in Kenya. The findings aligned closely with those of earlier workshops from Kenya. The challenges were contradicting ideologies in government agencies, very little support from the government, if any, poor implementation of policies in place, alcohol use disorders not given the required attention, lack of funding, unhealthy competition among actors, profit over people. Opportunities were presence of actors in prevention and treatment are working together, policies are in place for schools and workplaces. Some countries have policies that can be adopted by others, political goodwill, prevention and treatment actors work and comprehend each other, existing of platforms for prevention and treatment actors to meet, strengths of CSOs and bodies like NACADA should also be used, alignment of alcohol and drugs with network control programs to attract more funding. As a network, we are actively exploring opportunities to expand our project into other East African community partner countries. Thank you.
Thank you so much, Jane. Always fantastic to hear your presentation. We have just the final remarks now. We're a bit over time, but I wanted to mention as well, Jane mentioned Nakada, who's been very involved in this project and been invited to the sessions. Unfortunately, they have a side event at the same time. That's why they're not here. And our other colleagues from UDEL also have a side event at the same time. So we're all in this together and we're all doing it at the same moment in time. So, yes, so our final speaker, I mentioned quickly, he will give us just a short 5-minute video here to close us off. I am sure everybody knows him that's in the room anyway. His name is George Ochieng Odalo. He's the chair of the East African Network, an executive director and founder of Slum Child Foundation. So we'll share a bit more about him afterwards, but I thought I'd go ahead and share his clip to finish us off.
My name
by
is
me.
George Ochieng Odalo from Slum Foundation. I really wanted to join you guys for this year's Commission on Narcotic Drugs. Unfortunately, due to one reason or the other, I'm not able to join. I know some of you are wondering why I'm having a ball. My presentation today basically will be how to connect the ball and the player. And if you have a ball, the ball can't play in itself. You need someone to help it out. And if you are the player, you cannot play without the ball. Why am I saying this? When it comes to prevention work, I can be a prevention practitioner, but either way, I need someone to help me from the treatment bit. And if I'm doing treatment or someone else is doing treatment, they need the prevention bit. So these two need to complement each other. That is why we are trying to see how can we connect the parallel between treatment and prevention work. Hence, the good work that we are doing in East Africa. In our network, the East African, WFAD East African network, we don't want to stand alone, and we've done a lot of activities, some cutting across through treatment, others cutting across prevention, and just getting to know from the grassroots level what can we do to ensure that the service delivery is up to date. For example, I might be working with children doing prevention work, but if I don't have someone dribbling the ball on the sidelines when it comes to prevention, my work will be in vain, because I need a treatment expert to handle the father who comes from a family that is affected by drugs. I'll do my bit, they will do their bit. And I'm very much grateful to Soberlife, WFAD, SCAD, and Hard Voices for all the effort that we've been able to put in place as East Africa to ensure that we are able to do something. Good work was done in Kisumu with the good team in Kisumu, and we were able to see what is the relationship between prevention and treatment. Apart from that, we were able to do another session with the adults in Nairobi, whereby we were able to see what is the connection between young people and the adult when we are talking about drug use. And then after that, we were able to have a session with people or civil society organization within the East Africa, the larger East Africa, to share experiences. So my take home at this event is that I would want people to understand, as members of the East African Forum on Drugs, we've been doing a lot of stuff, but we cannot do it alone. We need to do it as a team. And as a team means we need to complement the good work that is being done by prevention experts. In Uganda, Rogers, my good friend and my mentor, is really doing an amazing work, but he can't do it alone. He needs other people to come on board. In Kenya, we are doing a good work in partnership with the government of Kenya through NACADA. And the government in itself cannot stand alone, hence the need to connect the parallel. In Tanzania, there is also a good work. If you go to Burundi, Elias is also doing a good job over there. If you go to Congo, WFAD is doing a good work, because we cannot be giving people intervention. We complain and we raise our voices that people need to hear the voices of the grassroots people, which is good. But mind you, if the grassroots voices are not complemented with the reality on the ground on how to sustain the initiative, it becomes very difficult. And we need to up our game to ensure that, one, we are able to connect the parallels. Treatment needs prevention, prevention needs treatment. And a practical example is what I've just mentioned. A child you are trying to save from substance use in a family that the father and the mother use.
So, oh, sorry. So we had some difficulties here with the last of the video, but it's also because we're being pushed out of this room because there's another event happening. So I want to take the opportunity to thank you all that are here, and we will add George's full presentation to this video. And I apologize, George, but you know how it goes here in the session. And I want to take a moment to thank everybody here and to those of you online, and we'll follow up. Thank you so much to the team online. Take care.